In this video, I will explain flow of blood through the right side of the heart. Keep in mind, in the right side of the heart, deoxygenated blood flows. First, as always, blood should go into the atrium. Then from atrium, blood flows through atrioventricular valve to get into the ventricle. And then from ventricle, blood has to pass through semilunar valve to get into the arteries. So let's start with the veins that bring deoxygenated blood into the right atrium. First, I start with superior vena cava, which is this vein. Superior vena cava brings deoxygenated blood from the upper part of the body into the right atrium. Then we have the inferior vena cava. Inferior vena cava brings deoxygenated blood from the lower part of the body into the right atrium. And then very close to tricuspid valve, I can see the opening of coronary sinus. But keep in mind, coronary sinus is a vein that we have it on the back of the heart. So when I look at the back of the heart, sitting deep inside the coronary sulcus, this groove, I can see coronary sinus. The deoxygenated blood from the wall of the heart goes through different veins and eventually gets inside the coronary sinus. Then coronary sinus releases the deoxygenated blood that it collects from the wall of the heart into the right atrium. So one more time, if I look at the inside of the right atrium, I can see opening of superior vena cava, opening of inferior vena cava, and opening of coronary sinus. Blood, the deoxygenated blood, from right atrium passes through tricuspid valve, or I can say right atrioventricular valve, to get inside the right ventricle. And then when the time comes, the myocardium of ventricular wall contracts and pushes blood up. But the first thing that happens when ventricle pushes blood up would be tricuspid valve has to close to prevent backflow of blood from ventricle back to the atrium. After tricuspid valve closes, then ventricle keep pushing to open pulmonary valve, and then ventricle pushes blood through pulmonary valve into pulmonary trunk, which is this blood vessel. Recall, pulmonary trunk is an artery because it takes blood away from the inside of the ventricle. And when I follow pulmonary trunk, that's pulmonary trunk, I see that pretty soon it divides into two pulmonary arteries. That would be the right pulmonary artery that takes the oxygenated blood to the right lung. And this would be the left pulmonary artery that takes the oxygenated blood to the left lung. And inside the lungs, blood becomes oxygenated, and the blood full of oxygen, as we know, should come back to the left side, which in another video I will explain how oxygenated blood flows through the left side of the heart.